Well, what do Adventists actually die of? And you can see as a percentage of all deaths, looking at all Californians, not Adventists now, nearly 40% die of heart disease, about 23% die of cancer, 6-7% of stroke, and so on and so forth, these common diseases. Amongst all Adventists, you look down here, and really the numbers are pretty much the same. Fewer die of COPD and smoking-related conditions, but there's no big difference. So what we're really saying is that the Adventists are dying pretty much the same things as everybody else, but the thing that's different is the average age at which they die of all these things. Non-Adventists who die of heart attack are dying on average at about 76 years of age, whereas the Adventists are dying at 83 years of age. These are for the men. So you've got that 7-year difference again that we saw for mortality from all causes. Here we see it also at the age of dying from heart attack. And so we say, well, cancer, the average age of dying of cancer is 71 years. Here it's 78 years. That's 7-year difference again. Stroke, 79 years and 86 years. COPD, 76, 83. Diabetes, 73, 81. I mean, it's kind of amazing to me. I would never have predicted this. It almost looks like whatever you're going to die of, you're going to die the 6 or 7 years later on average. And then we say, well, let's have a look at low-risk Adventists. What do I mean by that? That they're vegetarians, they exercise vigorously 3 times a week, they eat their nuts, their BMI is in the middle range, not too thin, not too fat, and they've never been smokers. If you put all that together, you find that these people are dying also relatively similar kinds of things. Actually, interestingly, a little bit more cancer and a little bit less heart disease, but otherwise relatively similar. But now their extension in life is about 12 years. And so they're dying somewhat of the same things, but that extension, I mean, that's a huge difference. How long is it going to take the general population with medical advances and so forth to gain an extra 12 years?
So what is a vegan diet? Vegetables, fruits, legumes, which are beans, soy, nuts, and seeds, and whole grains. This diet incorporates food that has not been highly processed and refined like sugars and oil. In this diet, you don't need to count calories, but may eat liberally and continue towards a normal body weight. Of note, doctors in support of this diet recommend that their patients take vitamin B12 supplements. Also, nuts have been shown to be helpful. However, a census is to keep it under 2 ounces of nuts per day. A randomized controlled trial published in 2009 by Dr. Neil Bernard studied the effect of diet on diabetes. He placed 49 people with type 2 diabetes on a low-fat vegan diet and 50 on the currently accepted American Diabetes Association diet. The graph shows hemoglobin A1C of the participants. For those with medication changes, values before the changes occurred were used in the graph to reduce it from being a confounding variable. You can see that the vegan diet showed a significantly greater drop in hemoglobin A1C compared to those on the ADA diet. A difficult confounding variable in this study was changes in medication. 17 of the vegan participants and 10 of the ADA participants had to have their medications lowered, whereas 7 of the vegan and 12 of the ADA had medications increased. Here you see that there was almost a 4-fold greater decrease in LDL cholesterol in the vegan group compared to the ADA group. Other clinically significant differences include a decrease in waist size of 4.2 centimeters in the vegan group compared to a 1.8 centimeter decrease in the ADA group. In conclusion, I highly recommend for clinicians and dietitians to pay close attention to this new paradigm that the low-fat vegan diet works better than the ADA diet in terms of lowering hemoglobin A1C, LDL, and waist size. Let's consider why it makes sense that we have such an increase in obesity and also diabetes following it. High fructose corn syrup is everywhere in our diet. An average American consumes around 60 pounds per year. Previous animal studies have shown that liquid fructose, which has dramatically increased in the American diet, causes insulin resistance, dyslipidemia, and visceral adiposity. In a recent study, for 10 weeks, people consumed 25% of their diet from either glucose or fructose. The bad cholesterol, LDL, and visceral adiposity both increased 4 times more with fructose than glucose. Also, insulin resistance increased 17% with the fructose group, whereas the glucose group showed no change. In various experiments, they took groups of people who had parents with diabetes and they compared them with the general public. And what they found was that they had increased fat inside their muscle cells. Now think about it. If you have fat inside your muscle cells, then your muscle cells are going to say, we don't want any more sugar. And so that's exactly what happens when you eat a large consumption of food and your insulin goes up and your insulin is trying to drive in your sugar into your body. Your muscle cells are saying like, look, we're already fat, we don't need any more sugar, and so they become insulin resistant. A group out of Yale has shown that those with increased intramyocellular lipid also have decreased mitochondrial density, decreased genes for mitochondrial production, and a 30% decrease in muscle mitochondrial substrate oxidation. The place that would normally burn up glucose is decreased because there's so much fat in these muscle cells, and thus it almost propagates the problem further. This theory provides a mechanistic foundation for why a low-fat vegan diet reduces type 2 diabetes, because you're essentially stripping the body of its fat from the muscle cells, and therefore you lose that insulin resistance that you acquire over time. A recently published paper on a prospective cohort of 38,000 people concluded that diets high in animal protein were over 2 times more likely to develop diabetes. This is important because normally people tell you to eat a high protein diet if you have diabetes. Stay away from those carbs. But taking intramyocellular fat into consideration, along with this study, one would assume that actually protein and fat might not be the best things for a diabetic patient. The total sugar we usually intake is 140 pounds. Cheese, remember, is around 31 pounds per year. And meat is 202 pounds per year. This diet has led to the epidemic of obesity and diabetes. But heart disease has also increased, which we will show is also a result of the food that we eat. Historically, in Vietnam, they found that 45% of casualties already had atherosclerosis. These were fit young fighters who already had atherosclerosis. In the Korean War, 77% of the casualties already had coronary involvement. When does this damage begin? Almost 3,000 subjects between the ages of 15 and 34 who died from external causes underwent autopsies in which pathologists looked at the extent, prevalence, and topography of the atherosclerotic lesions. Note in this prevalence map how as the children grow into adulthood, the percentage of fatty streaks and raised lesions increase. This study showed that fatty streaks clearly start in childhood. Other studies have shown that they progress to raised lesions and then further into atherosclerosis.